Good morning. Welcome back to Up Early, Lovebabz, Lovetalk. I'm Babz Ivy. Good morning, Dr. Asgarian.
Good morning, Babs. How are you?
It's very nice to meet you. The last time you were scheduled to come on a couple of weeks ago, and you got caught up in that whole airport mess.
I did. I appreciate you being patient, but yes, it was a tough month, the past month for travel.
Well, I'm glad that you could be on this morning, and thanks for getting up early.
Of course, no, happy to be on. So thank you for having me.
Oh, my pleasure. All right, so tell me about the free cancer screening. What are we screening for?
So, with the Shield test that's been out and FDA approved, we're screening for colorectal cancer. So, guidelines for all Americans are that you've got to get screened for colorectal cancer if you're 45 or above. And luckily, as of last year, we've got a blood test that can do that now too. So, a little bit simpler, more convenient, faster in terms of the time that it takes to get it completed. So, that's kind of what we're doing and hoping to get people screened so that we can kind of avoid the second leading cause of cancer deaths in America.
Oh, is it the second leading cause?
It is, unfortunately. So it's upside down. It's the second leading cause when you combine men and women who die from the disease every year. But if you catch it early, it's got a 91% chance of survival. So this is one of those where we're doing a bad job of screening. We're catching it late. The odds of survival, if you catch it late, are 13%.
Wow.
Of the people who die, unfortunately, from this disease, 75% of them are either unscreened or late to be screened.
And I was reading up on some of the reasons why. Because the whole process is so labor intensive.
Exactly. So these are people who are not feeling signs or symptoms, right? To get screened, it doesn't mean that you feel symptoms. It means that you've just hit that age, right? You're 45 or above. And they don't want to take time off work. They don't want to have to prep for a colonoscopy. They don't want to go through the anesthesia of a colonoscopy. They don't want to do the take-home stool tests. Those are at home for sure, but they involve a lot of steps that people, to your point, don't want to take, especially if they're feeling fine, right? So we want to kind of give doctors an option that's easier for them to order because they're always ordering blood tests. And now they can add one more blood test to that order, and we know the patient will get it done.
So will this make colonoscopies obsolete? Like, will we no longer have to have them? We can get this done with a blood test, or no? Because let me tell you something, Dr. Asgarian. That colonoscopy sleep is some of the best daggone sleep ever.
It is, right? And they call it twilight. They call it twilight
Oh
sedation.
my God.
Right, the whole time. No, no. So you asked a great question, right? So as a physician, it does not make colonoscopy go away, but what it does is something pretty amazing. Colonoscopy is a great test for colorectal cancer screening because it does two things. It tells you, can confirm whether or not there's cancer, right? Because you have a camera there. I see a polyp, I see something suspicious. But it also allows you to treat it because you're there. So you can
Mhm.
biopsy, you can remove a polyp, you can, basically kind of get it started in terms of the treatment. You can't do that with a blood test. So what this does is if people are hesitant, they can take the blood test. If they're negative, congratulations. As long as you don't feel signs or symptoms, you don't have to get screened again for another 3 years. But to answer your question, if you're positive, you do need a colonoscopy. But now you're not using it just to see if there's cancer there. You're potentially using it to actually treat the cancer too. People are more comfortable with that scenario than just getting the colonoscopy out of the gate.
Mm. All right, so I've had my first colonoscopy when I was 50, and then I had the second one when I was 60, and then they told me I have to come back in 5 years.
Merry Christmas.
Listen, I'm not one of those people. I like living and I want to save my own life, so I will get my behind in there, pun intended, and get in there and let them look up wherever they got to look up and handle whatever they got to handle. So tell me, what is the ethnic breakdown? Like who is having the most trouble with this in terms of race and ethnicity and age and all of that?
It's great that you asked that. So it's one of those where we've been trying to get screening rates up to 80%, period, across the country. And we can't get it, right? You are an amazing person because you're hitting it each time you're due. So you're in the 60% that are getting screened. We know that 60% of people who are due are getting screened. We know that there's 40%, so 50 million Americans that aren't. Now, luckily, we've had a lot of great advocacy. So we know that white people are getting screened really well. We know that black people are getting screened really well. Unfortunately, though, like to your question, in the black community, it's a more deadly disease. When a black person gets the disease, they're 40% more likely to die from colorectal cancer than a white person. And it's because
Wow.
it's more aggressive. We don't know exactly why, but we want to catch it early specifically for that reason, because we know that it spreads faster in that ethnic group. Now, unfortunately, in the Asian community and the Latino community, they're not getting screened that well. Their screening rates are still in that 40%, 33%. There's still a lot of hesitancy. And so we're really trying to see what it can do to boost the screening rates in those ethnic groups where they're really truly not being screened, even though, to your point, we've had doctors, we've had patients, we have people telling people it's time to get screened. They're still lagging.
Wow. Wow. All right. So tell me, when did you get involved in the colorectal cancer screening world? Like, what's your story?
Yeah, no, so I'm a primary care doctor by heart. I trained as an internal medicine physician. I wanted to help people truly stay healthy. And that was my goal, right? Not to care for the sick, but to keep the people healthy when they were sick, to get them right back to healthy. And the not to get it too long, but the administrative burden, all the things that they make primary care docs do, it just wasn't really fulfilling. So I left clinical practice and I focused my life on early detection and prevention. So I've been building these types of solutions for well over a decade. But specifically to your question, when this technology started about 5, 6 years ago to be cheaper, so the test could be more affordable, and to be able to detect better. So our ability to detect started to be really strong. That's when I moved into this world, and it's been amazing. So colorectal cancer is something that we thought everything that you and I have talked about, there's a need for it. But we want to move on to other cancers. We want to give primary care docs these types of tools so they can use them in their practice and really take advantage of new technology to get their patients to do things that they weren't able to get their patients to do in the past.
Wow. So you're looking at trying to screen for other things too, and that makes it easier and more patient friendly.
Absolutely. So, colorectal cancer is just one of those where we knew there was a need. We knew that there was a bunch of patients that were asking for something simpler and more convenient. The number one leading cause of cancer deaths in the country today is lung cancer. We've already got a study with more than 12,000 people, a lot of people in the Connecticut area, thankfully, who've enrolled in that study. And we want to test our ability to detect lung cancer in the blood. We're doing this for things that don't even have screening. We're thinking about ovarian cancer. We're thinking about pancreatic cancer. And then in the future, if I, you and I get to do this again down the road, I want to be able to come back and tell you we're doing this for chronic disease, people who have liver disease, who have kidney disease, and we can start to pick that up in these blood tests much better than anything available today.
So, 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 as a doctor, and you're in this political climate that seems to be so anti-science, how do you survive? Like, how do you survive? Like, how do you keep pressing forward when you're starting to sort of see institutions of higher learning research labs shut down and not funded, and like, what does that do for your work?
It's really hard. I'll give you a very clear example. We work with the FDA a lot. We want to work with the FDA for getting approvals, getting, information from them. They were shut down for the last month. We could not work with the FDA. And so you've got to kind of figure out how
And
to
you mean
call
the
out.
Food and Drug Administration?
Yes, so they're responsible for all of our tests, right? So they absolutely overview diagnostic testing like ours, and they were not taking calls, right? So they were still working, we hear, but we couldn't get information, so we had to wait. And so it's difficult. We have to have our strategy. We have to have what the best part of this is, amazing physicians that we work with that truly are, to your point, understanding of the science, understanding of new technology, and we've had that across the, Northeast, across the Southeast. These physician leaders that help us with our ability to do these studies and get these tests out and to keep them out is really what's important to us. And then people like yourself, amazing people that help us find patients that are looking for these tests and then nudge their doctor. Hey, doc, I know there's a new test out there. Is it available for me? Is it possible? So that they're not getting their information from the government, but they're getting it from physicians and from the community itself.
People can go to their doctor and say, "Hey, I heard about this screening through a blood test for colorectal cancer. Can I get it?"
We would love that. That exactly the way you said it. You don't have to say anything else. If you do want to use the name of the test, it's called Shield. So, hey, doc, I know there's this test called Shield. It came out, and again, it's FDA approved. And the good news is we're working with all the insurance companies across the country. As you know, it's hard with them. But now, a positive for the government, the Medicare covered it right out of the gates. So, anyone who's a senior, 65 and older, is little to no copay is what they'd have to pay for this test today.
Mhm. Well, it would make sense because I think it costs more to have a cancer diagnosis and go through, right? That's more expensive than a test that can be preventative.
Don't say that to the insurance companies, Babs, right? Like that's what we got to struggle with. So yes, but that is what we're working towards.
I don't understand why they don't err on that side. Like, hey, in the long run, this will be cheaper.
It's true, but again, not to get into the health economics too much, they hate paying for tests that are negative tests, right? So to your point, they'll happily pay if it's a
Boy,
positive test, but why do I have to pay when all these people are negative? It's not that, and so you have to work with groups, the patient advocacy groups, the physician groups, the groups that make guidelines, and we're working on it. The another great government story. The Department of Veteran Affairs, the Community Care Network, is now covering this test. So if you're under 65 and you've got those VA benefits, and just right after Veterans Day, it's all available to you as a veteran with little to no copay. So we're working to chip away at all these different groups that might be a little skeptical or might be a little bit more thrifty with their insurance dollars than we wish they were.
so is it your hope, Dr. Asgarian, to for doctors to have this as a tool and just become a regular part of the blood work, you know, done up. You know what I mean? Like when they say go get your blood work done, this would be one of the things that will be part of that whole series.
Yes. So again, you're a great example of the people who do it. But when a physician orders a colonoscopy, we know that less than 50% of people actually go get it done from studies that have been done, right? So they go,
Wow.
yeah, sure, doc, I got you. And they do not go get it done. We know that when they get a stool-based test, even sent to their home, just over 60% of people go get it done, meaning they return it, right? So a lot of times it just sits somewhere in their house and they're like, I'll get to it, I'll get to it. And those kits expire, right? So they can't just get to it. Then the kid is old and they don't do it. But when you order a blood test, to your point, as a physician, 90% of people go and get that blood work done. And so that's such a cool way to make sure as a physician that your patient is actually going to go close the loop and get the test. Now, if the patient's been a great patient and they go get the colonoscopy and that's what they want, for sure, go get that. But again, we know there's 50 million people that are available to these physicians that haven't been doing it. And so now adding that blood test to the regular blood work that they order could be a great way to chip away at that number.
Wow. Okay, so what's the number you hope to hit with this? Like what's the magic number that makes it feel like, okay, this is worth all this effort?
I think the National Colorectal Cancer Roundtable set that goal of 80% of people getting screened. Our goal isn't to just sell our test. Our goal is so that people get screened, to your point. So if this test pushes us over the edge and gets us to 80%, that would be amazing. The other thing to your question that we want to see is we want to see this drop. I want to come back and tell people it's the fifth leading cause of cancer death, right? It shouldn't be the second leading cause. So if we can get more than the 60% of people screened that are getting screened today, and we can reduce the mortality, so we drop this as one of the leading causes of cancer death in America, then we've been successful. And then we can say, hey, look, let's use this test for all these other reasons too.
Okay, so tell me about the organization you work for, the company, the corporation. What is it?
So this is all done by a company out of the Bay Area of California called Guardant Health. And Guardant Health has been in this business of trying to cure cancer through tests and data for over a decade. So the tests that were originally created that are still out there today were after someone got diagnosed with cancer. So when you got a cancer diagnosis, almost any cancer diagnosis, you took a Guardant test, and the Guardant test was still a blood test. It would tell the physician more about the type of tumor that you had, more about you and the type of biology that you had, and therefore gave the physician better options for treating that cancer. So it would say, hey, this patient has kidney cancer. It's this type of kidney cancer. They have this type of genetic mutation. If you give them this chemotherapeutic drug, you have a 90% chance of a cure rate. So we did that for over a decade. And then we started to say, hey, with this technology and with the affordability of blood tests, why don't we start detecting cancer? And it was super cool to do that. We did a huge study with, again, over 20,000 people enrolled. That study was published in the New England Journal of Medicine last March of 2024. And it really showed that we could detect cancer using our similar technology in the blood. So that's what the company does. And it's amazing to work there. Previously, everything was for oncologists and specialist physicians, and this is the first test, the Shield test, that we've really kind of geared towards primary care providers and gastroenterologists, GI doctors who do a lot of the treatment for patients with colorectal cancer.
Okay, so before I let you go, Dr. Asgarian, do you miss working with patients? Do you miss, doing that whole thing? Like, what? Do you miss it at all?
I do, Bab. I'm so glad you asked. I miss it tremendously. I'm the patient part. I miss that every day. What I keeps me going and doesn't make me regret the decisions I made is I do not miss the paperwork. I don't miss it at all. I don't miss doing my dictations. I don't miss being nudged by the health system telling me I got to see more patients because I'm under my quota. So that burden is off of me, but I do miss the blessing that was being able to interact with patients every single day.
Hmm. Hmm. Well, I do want you to come back so you can follow up because I want to know more about this. Like, I want to know how this goes and how many people appreciate and take part in getting the blood work done. I think, and I think there are probably some doctors who might be listening to be like, "There's a test."
That's what I hope. And it is. It's available to them. It's available to their patients. And then to your point, if there are people listening and they've got those stubborn loved ones that haven't been going to get tested, that haven't been going to get screened, and they can say, hey, you got one less excuse now. That means a lot to us because that's one less person that goes unscreened.
Oh, that's good. That's good to know. And I've got a good friend who was going for her first colonoscopy at the end of the week, and she was over here just going in on, oh my God, I have to do all this drinking of this potion and da da da. I was like, yeah, girl, you gotta do it. You gotta get that colon checked out. And so yeah, so this might make a lot of people feel a little bit more at ease.
Hopefully, and that's the goal, right? It's the analogy we use in medicine is you put your seatbelt on when you came here to the clinic. You didn't get in an accident, but if you did, that seatbelt was going to help protect your life. And this test or these tests for colorectal cancer screening are going to help protect you. They give you the best chance of survival if we can catch it early. So if you clicked it to come into the clinic, you might as well take one more screening test to keep your life preserved as well as you'd like it to be.
I love it. Well, you must come back. If you have some other screenings or something else you want to bring up, come back. We'll have another conversation.
Thank you, Babs. No, I'd love that. I'd tremendously love that. Thank you so much.
Thank you so much, sir, and enjoy the rest of your week.
You too. Thank you.
Thank you. All right, everybody, go talk to the doctors. Go ask for this Guardant blood work test. Just tell your doctor you're having, you want to have it done and make it part of your yearly thing or every couple of years or however often they tell you to do it. So thank you, Harry Droz. Harry Droz, did you get your colonoscopy done? I'm just checking in. And Karen Droz, get your colonoscopies done or ask about this blood test. I will be back tomorrow. Have a good one.